The pot's over $300 now.
Hi. I hear I had a first place shooter in the girls.
Did.
How about that?
My husband was mad because I beat his team by 4 birds.
Is that right?
And the oldest one was 16.
Oh my goodness.
The youngest one was 11.
Oh my goodness. Well, he's gonna have to practice.
Yeah, that's what I thought it was.
And then, of course, they put Charlotte in a hospital now because she's bleeding internally. She's back home, but they think her bleeding also. Had to give her.
You don't go with the video? Yes. Okay. In just a minute, I'll go ahead and we'll just show that before we actually get started. Okay. Is that one right now? I think what I'll do is I'll go ahead and do our normal, like the prayer and the pledge, and then when everybody sits back down, we'll just come and get videos. Okay, all right.
Both of them be down at the same time.
Those things going?
I like that word.
So gather you're going to film today, then, right? I will get you. I still haven't gotten Facebook or
YouTube?
yeah, my brain's dead this morning. Set up yet, but I will get that set up.
Do I put the comp in this one?
Yes. What do you got an email address?
Yes.
Can you write? You got something to write it down?
He's at the harvest with, the boy he works with down there,
I'm a bad public.
Okay, we're gonna get started a little early today because we're gonna watch a video. If y'all would stand with me and we'll go ahead and do the pledge. Again.
Okay.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Johnny, will you lead us in prayer, please?
Let's go in prayer. Father, we're grateful for all the blessings you bestow among us. We're especially grateful for the fellowship of this club, where it serves the community for Rotary to the world. We ask that you be with our service people at home and abroad as they serve, protect, and defend us. Forgive us of our sins, bless this food, go with us through this week. In Christ's name, amen.
Nelson,
Are you not going to do it?
you want to say, you don't
He
you
was
want
hiding
to
from you
say?
over here. You're ready, are you?
We're ready.
Okay. I'm going to make it easy for you today, but not quite as easy as the first verse might be. We need practice on the second verse of Rotary. So here we go.
R-O-T-A-R-Y, that spells Rotary. R-O-T-A-R-Y is one great family, where friendship lies for bands uplift, where each will strive his best to give. R-O-T-A-R-Y, that spells Rotary.
You guys are about to go.
As you all know, that September is Drug Take Back Month for Rotary. And our governor, Paul Ford, has made it our district's project for this year to get prescription drugs that aren't being used off of the streets. So we as a club purchased some banners, so we've got those put up over town, and we also have the yard signs, and I do have 2 yard signs left. If anybody wants to take them back to their place of business and put them outside, we would appreciate it. Just see me after the meeting. But back earlier in the year, the governor asked each one of the clubs to help pay for new campaigns to show throughout the state. And the videos are out. We did help, our club did help sponsor the videos, and we have them in today, and we're going to go ahead and show those right now.
We definitely have a problem. Prescription drugs have just simply become, I think, the epidemic of this generation. We've got to do better to protect our kids.
In 96 or 98, the big pharma came out with these dangerous drugs like Oxycontin, hydrocodone.
We've seen abuse all the way down to 7, 8-year-olds using prescription drugs.
We actually showed a few years back we were the #1 state in the nation for the abuse by adolescents of opiates.
64% of teens from the age of 12 to 17 have admitted to using and abusing prescription type pills, medicines.
There are more kids that die because of prescription drug overdose or drug overdose than there are dying in car accidents today.
It's all simple. It looks easy to the kids to go into the medicine chest and take some pills and get high, but they don't realize, they don't understand that this may be life-altering.
70% of what's being abused comes out of our homes, either willingly or unwillingly. And so we want to make sure that people, the prescriptions that they need, especially the ones of abuse, get locked up. And then the ones that you don't need anymore, to store them properly. a drug take-back or a 24-hour drug take-back box is a great way to do that.
What can you take back? The answer is anything, whether it's a solid dosage form, a liquid, prescription medicine, over-the-counter, herbal, vitamin. If you're worried about the environment at all, this is a method where these medications are destroyed by incineration. They're not going in a landfill, they're not going in a water supply, they're not going down a toilet or anywhere else where they can be used. This is the best method to get rid of these pills.
As Attorney General, I am committed to bringing awareness of this issue and to work with community leaders, law enforcement, physicians, and pharmacists to eradicate this problem.
We're looking at pulling in 20,000 pounds of pills every 6 months. That is an astronomical number. Arkansas is among the leading states in the nation when it comes to taking prescription drugs back off the street.
These collection sites provide a safe and easy way to properly dispose of prescription medications and to help you protect your family. For more information, visit artakeback.org to find a drug take-back location near you. Let's protect our kids.
Independence County is one of the, I believe, only counties in our area that actually has a 24-hour drug take-back box that is up 24/7. It's located down at the Independence County police side. It's there. It looks like a big vault, and it now has a Rotary sign on it that says, "Put your drugs here." So if you know people that don't use all their prescription drugs, or they're outdated, or whatever, just have them. You just can take them, put them in a Walmart bag, and take them down there. You don't even have to go in and see anybody. You can just put them in that box yourself. So let's spread the word and try to get those off the street. All right, this week we did not have any birthdays or club anniversaries unless somebody wants to admit to something. No, everybody's gonna be like me, and it's gonna be a secret. Okay, Johnny, we're up to you then. Sergeant Arms report.
Good. Two ladies moved into an apartment complex on the same day. For several weeks, they had a conflict over whose parking space it was at the front door, both thinking they had been assigned. Management of the complex wouldn't do anything, said work it out among yourselves. One of the ladies sued the other lady for her parking space. The judge called the case, looked at the file, reviewed it, and with the wisdom of Solomon, he said, being courteous as I am, will the older of the two ladies go first? All charges were dropped. Best friend forever. Who am I going to pick on today? Oh, Steve.
Okay.
You ought to be easy to do. You're
saw
close to him.
You saw us in here. You saw us in here today, right?
No,
We actually met here. We actually met here earlier.
I saw nothing. But I'm glad you're prepared.
My RFF is.
Wait, are we allowing cheat sheets?
Of course.
Okay.
I'm just teasing.
As long as they know who it
You
is,
sent this out.
I'll call on you next, Mr. President.
I don't have
I
one.
know, we're going to explain.
Nobody wanted to be my friend.
My Rotary friend forever is John Peake. He is back in Batesville now, having retired after a career in higher education. His wife, Mieko, I think most of you know, and he has two grown sons. One is in St. Louis, and I forget where the other one is, in Atlanta. His favorite hobbies are doing yard work and reading. His favorite food is pizza. Put everything on that when you give him that pizza. I pressed him for his favorite drink, and he kept insisting it was water.
H2O.
Just H2O, yeah. He enjoys being part of Rotary for the camaraderie and for the information that he gleans from presentations like we're about to have today. And he, not surprisingly, is interested in Japan. He enjoys traveling, vacationing on the mountain trails of Japan, and his lifelong dream is to be fluent in Japanese.
I wonder why.
I wonder why. John P.
Thank you. Give him a hand. He has. John
quite a bit of it recently.
1690 Fairway Drive.
I
Mowers in the
work from
basement.
7 in the morning till 10 in the morning, and it's $100 an hour.
That's okay, I only want to give you 1 hour. Want it all done. Thank you.
Okay. Kurt, do you have a secretary's report for us today?
I count 25 members present today, but I want us to give a good welcome back to 2 of our members that have been on leave here recently and both joined us back today. One Jacob Landers and one Penny Reeder back there in the back. And I think I only noticed 2 guests here today because you all are both in the program today, right? Okay, so if you would stand up and introduce yourselves.
I'm Emily Campius. I'm a senior at Batesville High School and a representative from Batesville High School Student Council.
Welcome.
My name is Joanne Lee. I am as well a senior representative from Batesville High School Student Council.
Welcome to both of you.
I'm Cody Passmore. You guys may recognize him.
I didn't think
He
of
used to
him
be
as
our
a guest,
guide.
but he's
Yeah.
here.
He actually came as a guest today.
Welcome.
And he was on a winning shooting team Saturday. Okay, let's see. Brenda, Deanna, do y'all have anything about service that we need to discuss?
Well, we had the banners up for the drug take back. And then the next thing is we have the highway cleanup for the highway north of town. Thinking about doing it this, we're gonna switch over and do it a Sunday afternoon now instead of Saturday morning, because I understand everybody has family commitments and things like that. So I've selected the date October the 25th. That'll give us time to possibly get high school students involved too. That'll be Sunday afternoon, October the 25th, starting between 2 and 4.
I like clean up
You're
October
volunteering?
25th, 2 to 4.
No, I want to say something.
Well,
She may not say this, but I will. Last time we did that, there was exactly 2 of us that showed up to do the whole stretch. We can do better than that next time, especially given all the people that voted to maintain our part of the highway.
thank you, Kurt.
Do we have notes of the ones that voted?
I'm sure there's a record there somewhere.
voting to have Kurt do it.
And then the third thing is the dictionary project for the 3rd graders. Is I've got a count of the schools. People have requested to take dictionaries to specific schools. Come see me. Let's get started. We've got our counts. I've got phone numbers for the contacts and schools who can start taking.
So if you want to help with the dictionary project, see Brenda. She's
Let's get going.
getting ready to go.
Yeah.
All right, sounds good. Ken, do you have anything you need to report? We're doing okay?
We're doing okay. I didn't want to steal your thunder. I didn't know if you were going to announce.
Yeah,
how well we did.
I'll talk a little bit about it here in a minute.
I'll let you do that first.
All right. And then I was going to back to the video that we just watched. I was going to mention too. I have that in an email format, and the email that I got sent says that we can send that out to people to show it, like churches and schools and things like that. So if anybody wants a copy of that email, let me know and I'll try to send it out. I guess it works okay on the email, did it, Donna? I can't open it at the bank, so I don't
A
know.
couple of them are just pretty big files. They take a little bit to download. And so we've got the shortest ones for today.
Okay, so there's different videos than on there, 5 videos. Okay. Well, if anybody wants a copy of those, let me know and I'll get it out to you. Let's see. Our door greeter today was Phil Baldwin. I don't see him here. So I will greet you all. Thank you for coming. Next week is Nelson Barnett. He will be door greeter. The track shoot. I can't say thank you enough to everybody that helped on the track shoot. I'm not going to name names because I'm afraid I'll leave somebody out. But this is, to my knowledge, this is one of the biggest successes that we've had since I've been in the club on any of our fundraisers. If we had not had any expenses, we would have made $8,836. So that is how much money we actually brought in through sponsorships, through team signups, and through the selling of all the stuff that we sold and through the raffle. We made $539 on food, $387 on the silent auction, and we made $1,960 off the raffle. So I really think it was a huge success. And then after we paid all of our bills, and this year, now remember last year, we had several of the Rotarians that did not charge the club. for the stuff that they paid for. This year, we paid everybody. Last year, we made about $4,000. This year, everybody got paid, we made $5,070. So to me, that was a huge success. I really want to thank everybody that was on that planning committee, everybody that came out. Jerry came out, Johnny sent people out to get lunch. Everybody that just came out and helped support us and that did the teams. I felt like I got a lot of good feedback. Everybody had a really good time. They really enjoyed it. The weather was perfect. So it just went off without a hitch, actually. And I can't say thank you enough. So we did really good. You all deserve a big pat on the back. John Vestal has chosen to drop his membership for now. I don't know how many of you know, but he is no longer with Lyon College. Carter and he had lunch the other day, and he thinks right now he may stay in the area, and if he does, he may request re-membership later on, but at this time he has requested that we drop his membership, so we have done that. The next thing that I have is the Meals on Wheels donation. Don't forget that the board decided last week to challenge the membership to bring in money the rest of this month to help us donate money to the Meals on Wheels project. I think that's all I have right now. Carter, you want to introduce your guests?
We continue a special month of White River Medical Center providing the program. And Sheila, I just want to thank you again. Everyone has been so excited about the programs this month. Last week was amazing, and there's definitely a buzz for this week. So we're excited about today's program. And so let's welcome Sheila Mays. Any comments on the Razorback football game?
I just wondered if Carter was going to be speaking today because, you know, my kids have all left home. My daughter's a junior at the U of A, and my boys are graduates, and so we seem to have some free time on our hands all of a sudden, and my husband's like, let's, you know, go to a couple more Razorback games, have a good time. So we've been 2 weeks in a row. We went to Little Rock, and we went on to Fayetteville and participated in Dad's Day activities, and 2 weeks in a row, it really hasn't been great times. We had great weekends and not a great athletic result. And I'm pretty sure that Carter was going to say, no more. You're not invited. No more Razorback games for you. Obviously, you must be the bad luck charm because something's going on. But we had a great weekend in Fayetteville. So unfortunately, the game just disappointed a little bit. Next week, we're going to bring two of our physicians that we've recently recruited to White River Medical Center. Dr. Jody Chaudhry, who is an internal medicine physician, and Dr. Salinder Singh, who is a rheumatologist, and that's a specialty that's new to White River Medical Center. We feel like it's definitely going to fulfill a need that we have in our community. We want to give you an opportunity to meet these physicians, interact with them, and to talk about our physician recruitment program and how critically important it is to the success of our hospital and how important it is to the development of our community. So I'm excited to talk about that next week. But today, we have something even more exciting to talk about. So it is my pleasure to introduce to you today Carla Langston. She is the director of our Community Care Network. Carla completed her undergraduate degree at the University of Central Arkansas in Conway. She is a nationally certified operating room nurse and has spent the majority of her 20-year career in nursing as a surgical nurse. For the last 7 years, she's been the nurse manager of our surgical services department at White River Medical Center. She recently accepted the position of director of the Community Care Network. She is involved in WRMC's perioperative surgical home initiative, and I'll let her tell you about that, and serves as an instructor for the Health Coach program, which she is also going to talk about today. Carla is currently enrolled in the Master of Science in Nursing program, the Family Nurse Practitioner track at Arkansas State University. Please welcome Carla Langston.
Sometimes I talk loud enough where everybody can hear me. Can y'all hear me? All right. Well, it's my pleasure to be here today. I could talk all day about everything I've seen as I've been a nurse for now 20 years and the way my career path has gone. And I'm most excited about where it is right now, which is leading our community through the better health of our community. through 3 initiatives that we've taken on at the hospital. One is health coaching, 2 is the perioperative surgical home, and the 3rd one is population health. So we'll talk about all those real quick. So that is why we got started in health coaching, was for quality initiatives. So why health coaching? In January of 2015, the Health and Human Services Secretary sent out this announcement that basically said quality versus quantity. So we now had to be able to focus on how we were going to take care of our patients at a quality level so that they're not readmitted, so that their health is optimized in a way to reduce readmissions. So they said, you know, we're saying that the goals now, the first time ever, we're going to have measurable goals and through the Medicare program. And at the bottom it talks about, you know, in 2016, through accountable care organizations and bundled payments, we're going to reduce by 50% the payments to these models by the end of 2018. And the goal 85% by 85% of all traditional Medicare payments to the quality or value by 2016 and 90% by 18. So it's the first time we've ever been told, you have to do this by now. This is how we felt. The iceberg is melting, or you can kind of look at it as like the rig in the middle of the ocean, the oil rig is on fire. That's kind of how we felt. What are we going to do so that our iceberg doesn't melt? And that one penguin right there with the suitcase, I call him Dr. Steele. Have any of you guys met Dr. Chris Steele at the hospital? He's the one penguin that said, we have to figure out a way to get off this melting iceberg. Follow me. So this book was by John Cotter, and he's the one that told me, Dr. Steele's the one that told me about this book. And he said, basically the story is that you have this one penguin who says, he's figuring out that there's cracks and things in the iceberg, and we have to figure out a way to get the colony off this melting iceberg. So he goes about trying to get his colony in line with his vision to get off the iceberg. So it's analogous, or it's the same as we are with change. We don't really want to address the change that we see in front of us, but we've got to figure out a way to do that. And so it's an organized way of getting together to get everybody off the iceberg before it melts. So again, the 3 quality initiatives were health coaching, the perioperative surgical home, and population health. Each are a little different, but they all work together for the growth of our community and developing a healthier community. So what is quality? Of course, here's a simple definition for it. The standard of something is measured against other things of a similar kind, the degree of excellence of something, quality of life, or it's a general excellence of a standard or a level, quality of leaders. How are we going to measure it? It is apples to oranges. Same fruit, but different. This is how we're going to measure it. Value-based purchasing. Have any of you heard of that? That's a way, it's 70% quality, 30% measured in other ways, but the basics of this is 70% is on our patient satisfaction. Element number 1 is standardized performance, which is patient satisfaction. Element 2, transparency and public reporting. Now, more than ever, can you guys get on and see where White River is in the grand scheme of quality? And if you can decide now, do I want to see my family there? It's out for everyone to see. Element 3, payment innovation. How are we going to get paid? Element 4, informed consumer choice. Then we have the triple aim. This is how we're going to do it. We're going to have we're seeking better health for our population, better care for the individuals, which lower the cost through improvement. So if we increase the health of our community and provide better care to those that are there, we stand to A, get our population healthier, Batesville in general, which will drive down the cost because they're not readmitted as much, and that's important to everybody that pays taxes. We have a systems-based approach We have the observed team, and I'll talk about the expected team in a second. On the observed team, we observe clinics, hospitals, post-acute care. In our clinics, we have to increase communication and accessibility. We started using an app called PingMD, and this is a way to be able to communicate more effectively between providers and between physicians and nurses. You can send now encrypted messages that are not able to be used any other way, just between the users that have this certain application, and pictures as well. We offer the patient portal now, where anybody can get on there. You get a little code, and you can go and look at your lab work, your physician notes, your anything, so that you don't necessarily have to have that follow-up appointment or make that call. You can log on yourself and look at it. The hospitals began to look at availability of clinicians, communication between physicians, and early interaction with care coordinators. I want to speak real quickly about the availability of clinicians. We've had an increased number of medical students, but a decrease in the number that are going into family practice. More and more people are wanting to specialize in medicine. And with that, then enter the baby boomers. Baby boomers are retiring, so we're starting to see this shortage of family practitioners. So what are we going to do to address that? Some people say it's mid-level providers, like what I'm going to be doing, family nurse practitioners. So mid-level providers, some people feel that's a derogatory term because they're much more than just mid-level. But those are advanced practice nurses and physician assistants. They practically do the same thing. Physician assistants is the medical model. They can go into it after they've majored in the sciences and then follow the physician model. Nursing, you have to have a nursing background. You have to practice on your own before you're ever able to get into nurse practitioner school. And you have not only the nursing focus and wellness, you have the physician model as well. So it offers a holistic approach instead of just the medical model. So what I like to say about the availability of clinicians is that you now accentuate your patient's care that they're getting, because we collaborate with the physician. When I finish school, I'll have a collaborative agreement with my physician, and I feel like I'll be able to offer my patient better care. Does that make sense? So communication between physicians had to get better. Communication, or the early interaction of care coordinators. We have one care coordinator that's an advanced practice nurse at the hospital, and she supervises a team, and we have one on each unit. We draw through there, and we pull off our records, who's at risk for high readmissions, and we target those patients. And we work together as a team, a multidisciplinary team, to make sure that we're offering that patient the best of the best. On any given day, we have about 70 to 100 high-risk patients. So 70 patients that you have to look at in one day to make sure that their plan is optimal. It's a lot of work, and it takes a lot of people. Post-acute care, accountability of the post-acute care providers. We're talking about home health, nursing homes, inpatient rehab. If we're going to be partnering with everyone in the community, we want to make sure that they now know how important quality is. Expected team, you have your clinicians. We've got to make sure they appropriately document, because if they don't, they're not going to get paid, we're not going to get paid, and it doesn't provide the patient with the best care. Appropriate hospital status. So what we've learned with this, real quickly, about the documentation of comorbidities, have y'all heard about ICD 910? Have y'all heard about that? That's this new way of coding that basically provides for the more comorbidities you code for, the more reimbursement you can get. But it's more than that. It's about the physicians taking the time, and the PAs and the ANPs or the APNs taking the time to really get to know that patient, so they document every single thing that they know they need to provide the best care for that patient. Appropriate hospital status. We want to make sure that the people in the hospital are appropriately put in the right spot. Like observation status needs to be tagged occupation status. And then it's the people that look over the charts job to make sure that when they don't meet that criteria anymore, that we put them where they need to go, either home or to a different level in the hospital. And that's important for you all, because then your insurance is going to cover that stay. Does that make sense? Documentation improvement team, we put together a team to just make sure that everybody's doing what they're supposed to do. They audit charts, and we also have an external group of physicians who audit charts. So what has been done? We don't want to just do what's been done. We want to do it better. So enter the community care network. And the community care network is to improve the care of our most vulnerable patients, the ones we talked about, the ones that have a lot of things going on, the ones that live in way rural Arkansas, that don't have rides to get to where they need to go. We're talking about the ones that smoke, the ones that do things that they are not educated enough to know how to stop or why they should stop. And we're targeting those most vulnerable patients to make sure that they know what's available. Provide pre-health students. We're talking a little bit about health coaching here. Our pre-health students at Lyon College. So we partnered with Lyon College, and we decided to get pre-health students involved with these this group of patients. We wanted to teach them how to do some basic history taking, problem solving, while caring for the patients, and this not only helps us, it helps them, because how competitive is medical school now? It's highly competitive. So if they've done some things on the front end to set them apart, it helps them in the long run. Plus, it helps them figure out, is this really what I want to do? Because I can tell you, from working with the juniors and seniors at Lyon College, they do not know how to talk to patients, and they won't know until their first encounter. So this is our way of helping them sooner, and then they can decide quicker if this is really what I want to do. So we have also identified and enlisted the help of federal, state, civic, religious organizations to aid in the care of the most vulnerable patients. In 2013, we started this health coaching program. It was based on a program from Dr. Barry Bittman. He put together this program that basically says if you use health coaches to help coach your community, it will drive the quality up. We're the first health coaching program in the state of Arkansas. We currently are one of two. The only other one is in Northwest Arkansas at Washington Regional. We're entering our 5th semester of education at Lyon College. They have to finish 2 semesters. One is the theory, and the second part is the practicum, where they get one patient and work with that patient. And after they finish, then our hopes is to hold on to them as a volunteer. And over the summer, I had 4 volunteers. One was from UCA, who's pre-med, and she came saying, I want to volunteer. And I latched onto her really quickly. And then I kept 3 previous students. And we worked with this population of patients. And then we continue to link community resources with the patients to further their overall healthcare experience. So what is a health coach? A health coach is that supportive person. It's basically just that one-on-one. Many of you have family members that can help you if you don't understand something, or you want to bring along your wife to the physician's office with you just for that second person. There are so many people out there that don't have that person, and the health coach has been that person for them. The health coaches help these patients with resources that we can find in the community. Literacy is a huge issue. It's huge. Most of our patients read at the 6th to 8th grade level. I could talk about this stuff all day long. We have to figure out a way to educate those patients that's not talking over their head in a way that they can understand. And most people can read at a certain level. So we had to make sure we changed all of our discharge instructions to that 6th to 8th grade level. We had to make sure they have rides. Where do they get rides? Who can they call? We have to make sure that these patients understand how to utilize their pharmacy. Where can I get my meds filled? What if my insurance doesn't pay for it? What are the other options? What is an indigent program? How can we do these things? Because the bottom line is the physician gives a prescription, you take it to your pharmacy, they say it's going to cost $400. You need that for food and gas. You're not getting the prescription. We want to figure out how we can do that, taken care of. Equipment, lots of patients need equipment in their home, scales. If you're a CHF patient, that's congestive heart failure, and you retain fluid a lot, your goal is to make sure you don't gain too much fluid. How do you do that? You weigh yourself every single day. Most of our patients don't have a scale. And on top of that, some of them can't even see it because they can't see it. So we have lots of things out there that we work for with these patients. Education, again, let me read these instructions to you and let's talk about what you think that means. Support and understanding is the biggest thing, because what we've seen is the more you work one-on-one with a patient, the more rapport you build with them, and the more they trust you. You're their person. Outcomes. Right now we've had 60 students come through the program. We're the first health coach program in the state, featured in the Arkansas Democrat Gazette in January of 2014 and October of 14, presented at UAMS in February, featured in the AHA, that's Arkansas Health Association, Executive Leadership Conference in 14, and the AHA newsletter in December of 14. Okay, if you can see this, I don't know if you can, but over here on this side over here, the left side, that's dollars. And at the bottom is in months. The first group of about 12 worked with 12 patients, and the peak there is inter-aligned college students. Spending these 12 patients, spending right around $900,000 on health care. The health coaches worked with them, and in July of 14, right around $200,000 reduction in health care needs for these patients. Now, it's not, it could, I have to put out a disclaimer. Somebody could have died, and that took care of a whole lot of it. We don't know yet. But these are just rough numbers from where it was $900,000 Medicare patients down to $200,000. What an impact. I had no idea it was going to be that huge. So an example of a high-risk patient, we've been talking about some of them. We had a patient that had multiple health care issues, colon cancer, had part of his colon removed, an ostomy, generalized weakness because he was just sick all the time. Our health coach found out he was sleeping on the couch because he could not make it up a couple of stairs to his bathroom, where his bedroom and bathroom on the same level. No, the bathroom was on the same level as the living room. He couldn't make it up and down those steps at night when he was feeling weak. She researched some things, and we got a handrail installed for that patient for free, so that now he can use that handrail to help him up and down the steps. Another high-risk patient, CHF patient in Batesville, her daughter and granddaughters involved in a car accident in Texas. A lot of stress and strain on her, and as you know, stress makes everything worse, so your health care declines just a little bit when you're under a lot of stress. Traveling a lot to see them, didn't really have the means to do that, but was trying to get to see her family. Few resources available to help her. The health coach set up a GoFundMe account and raised money so that that patient could see her family. These are just a few little testimonies. I don't know where we are on time, but I'll read through them real quick. I think that this experience has further deepened. These are students that are now graduated, deepened my passion for medicine to serve others, to provide them with the knowledge, tools, and treatments necessary to better their quality of life. This course really changed me in that it reminded me about my love of medicine, learning about it, and then applying it to the real world. My vigor for this bloomed with this course. Also changed my personal expectations of patients. Maddie says, in the future, I look forward to being able to continue health coaching in our community, and that's awesome, because that's what we want. We want these people to continue on with these things that they've started. I'm very thankful for the experience thus far and look forward to seeing the program grow with the addition of new health coaches each semester. Overall, the health coaching program at White River Medical Center has been a great opportunity for me. And Ryan says, finally, we can talk of my personal experiences with the program in its entirety. From the program, I learned about disease, nutrition, resources, and the trend of healthcare today. Working with my patients allowed me to learn about their diseases, the nutrition essential for their health, resources available to help them, like cardiac rehab, and the focus of medicine on prevention. These are all things that I would not have learned without the program. Now I'm going to talk just a little bit about the perioperative surgical home. That's health coaching. Perioperative surgical home is what we're doing in the hospital, which is a multidisciplinary team aimed at standardization for the perioperative care and the strict adherence to ever-changing standards of care. So in 2014, we joined approximately 40 other hospitals in the country. Did I skip one? As the only hospital in the state of Arkansas to begin this process. The American Society of Anesthesiology was organized the collaboration. They went to a quarterly meeting in Chicago to update the members of the progress. And we also chair the committee that obtains and shares the protocols created for the entire country. And that was started by Dr. Steele. This is what the model looks like. It's kind of a busy slide, but at the top you have administration, because if administration wasn't on board, this wouldn't have happened. Administration. Then we have our perioperative surgical home directors, such as Dr. Steele, Dr. Angel. The managers, we have a business manager that just came on, and then myself is on that team. We have the intraoperative team, the pre-op team, the post-op team, the data and metrics team, and then we have the team leaders, and then we have the teams at the bottom. So a lot of work going on basically to look at how we're providing care for the patient and make sure it's number one. So as you can imagine, you visit your doctor, you need surgery, you have lots of questions. We have to set together an optimized plan. This is the plan you need to be on to have your surgery. Once you're optimized for surgery, you're scheduled, and you receive a detailed blueprint of how it's going to happen. We already know before you get there how many days you need to spend in the hospital, what prescriptions we're going to have for you, and how you're going to get home. This is a busy slide as well, but it just tells you all the work that went into creating the blueprints. It's from beginning to end. When you arrive, what you're going to eat, drink, your medicines, your anesthesia. We've got it down to even there's different types of patients. Who can metabolize the pain medicine, what the best, and who needs this set of pain medicine, and who needs this set of pain medicine. And we need to give them things to decrease their bleeding. How long will they be in post-op? When will they be able to eat? When will they be going home? How long is rehab? When will they see them back in the clinic? And then about contacting your doctor anytime. Those are all just, that's a basic plan, but a lot of work involved with those. And then we've hired like we talked about, a business manager and a clinical manager for the perioperative surgical home. We already started implementing it on the total joint replacement. So all of our physicians, what has to happen for that to go off then is that y'all know Dr. Allen, Dr. Angel, Dr. Carpenter. They each are different places in their career. They don't operate the same way. They don't want everything to be the same, but now they do, because it's what's best for our patients. So they had to get on board, and they realize how important all of this is. So I can't say enough about the physician collaboration that we've had. This process is also, we've started it on other processes as well, like colon resections, vascular cases, and hysterectomies. We've started it with those. We're the first perioperative surgical home in the state, similar to us being one of the first with health coaching. We recently featured in the winter 2015 publication of the AHA, and will be featured in the upcoming American Society of Anesthesiology. And then the and then Dr. Steele is on this, with the Shared Protocols Committee for the National Perioperative Surgical Collaboration. So like I said before, Dr. Steele was the penguin with the suitcase, and he's carried us all through this whole process. A little bit about population health. This is the last thing I'll talk about quickly. Population health can be defined as the overall health outcomes within a group. Our group is Batesville. That's the most immediate group. But White River Medical Center serves 50,000 people. So we have to look outside our group as well. We want to see how healthy that group is. These groups are often geographical populations such as communities. It can also be in subgroups such as employees. So we have to look at the overall health of Lyon College, White River Medical Center. And then you can start to break it down to see why are the employees of White River Medical Center unhealthy and what can we do about that? So there's a lot of research. Overall, the health could be quite high if the majority of the population is relatively healthy. What are your thoughts on Batesville? Overall, are we a healthy community? I agree. Overall, Batesville's not a very healthy community. Why is that?
It's just with our rates of cancer and smoking and all kinds of things we're at the
Exactly. The top 3 diagnoses in Batesville, Arkansas are congestive heart failure, diabetes, and depression. Why are they depressed? Because they have congestive heart failure, diabetes, and they can't eat what they want to. And I don't have the way to do it. I don't have any way to get there. I need help. My doctor doesn't listen. Things like that. There are many factors that influence the health of the population. Available health care. We're so lucky. I think about that a lot. In a community that is not overall very healthy, we're very lucky to have White River here. We're very lucky to have all the services they provide. We got to look at the individual behavior, the social environment, physical environment, and genetics. I'm also thankful that we have things within our community that focus on health and well-being. The track that goes from the city pool all around Batesville, you can get on that and walk. It's available to anyone. There's lots of things that Batesville has done to help target the overall health of our population. So with population health, we did hire a population health director. She's from Tulsa. She's awesome, and she's got a big vision for how to help us direct our population to be healthier. Plans are being created and working on implementation of programs, growth in thinking outside the walls of the hospital, because I don't just work in White River Medical Center. If my patient needs something and they can't get there, I go to them. That's a new way of thinking. So we've got to get more people involved with if they need us to do a little blood sugar check on them and they can't read their glucometer or they're out of batteries, I'm taking it to them. Because what does that do? That helps them, A, with figuring out what needs to go on, but B, it helps prevent them from having to use their resources to come back to the hospital and get another readmission. Increase the overall wellness of our community. We talked about decreasing readmissions of high-risk patients. In the vision, we believe ourselves to be the model to other community hospitals on how to thrive in the new healthcare environment through achieving the triple aim. Remember the triple aim? And not only are we changing in the new healthcare environment, it is clear that we're leading this change in North Central Arkansas. And that's all I have today. Any questions? No? Yes.
So last week and this week both, it's been all about quality and different programs, but 2 very cutting edge programs that have been started at White River, both geared towards improving quality. Can you talk about the iceberg? What caused that melting process essentially to start happening? Where is that emphasis coming from?
I know that it came from the numbers. I mean, the high readmissions that everyone was having, plus we had to start figuring out how to spend less money on healthcare because, and especially with Medicare. So the government basically says, we're only going to pay you for quality now, not quantity.
Is that healthcare reform or?
Part of that is
Yes,
healthcare reform, and I know in a lot of venues, healthcare reform can be a very controversial topic. People have a lot of opinions about it one way or another. But one good thing that is happening with healthcare reform is that it is forcing hospitals to take a really hard look, and all healthcare providers, not just hospitals, anyone who receives reimbursement for delivering medical care services has to do that. And one of the reasons that health reform is doing that is, in the past, the Medicare program was basically founded on the principles of there will always be more workers paying in than there are people collecting from those benefits. Well, that's flip-flopped. We are, if we haven't already reached it, we are fast approaching the time when there are more retirees than there are workers. And so you have this huge financial burden. The other thing that you've discovered is that, when Medicare was implemented years ago, Americans lived to a certain age, and I think it was probably 67 or something like that. Now it's 79. So Medicare was designed to fit a program for people who lived a few years after retirement. Now they will live as long or longer in retirement than they live as a working person paying into the system. And when you have that financial flip-flop, you've got to figure it out. The other part of that is it's the right thing to do. The quality of life of our patients, you know, there is a financial impetus, and there's a financial impetus to a lot of very significant change in any industry. But the other thing is it's really the right thing to do. If you have diabetes, are you educated enough to know that if you don't control your diabetes, that eventually it's going to lead to amputation, it's going to end in blindness, it's going to end in kidney dialysis? I bet you if you walked outside and picked 10 people off the street and said, what does it mean if you have diabetes? The only thing they would say is that I can't eat sugar. They have no idea the serious implications of that disease. And don't usually find out until it's a little bit too late. So that's one of the things that we have to try to do.
Anybody else? Thank you so much. We have a literacy project our club does, Carla. And we're going to donate a book to the Independence County Library called Otis. And inside it says this book is donated on behalf of Carla Langston with WRMC for speaking to the Rotary Club of Batesville on September 21st, 2015. So that'll be at the library soon. Okay, Carter, you want to get somebody to draw for the Joker? We're at $345 today, and if my math is right. No, I didn't even realize we had started. We're recording the sessions now.
And I will have a YouTube account set up soon. It will, if you need a makeup, you can either go to the YouTube account or Facebook page. So, but that doesn't mean that you can just stay at home and watch the meetings every week. You know, this is
Yeah, we want you here in your pew, but if you have to miss, we are recording them now.
Yeah, so remember that, so don't be ugly during the meetings.
Are you going to move into live streaming?
Well, we might do that. That's
Oh, no.
That might, no.
No. We need like at least a 15-second delay. Okay. We're at 345 on the Joker draw, which divided by 2, I believe, is 172.50.
The last three numbers are 694.
694.
Cody is gonna draw for us.
694.
Because I'm sure he's luckier than me.
694. Don't forget, I still have a couple of drug take-back signs up here if anybody can take them back with them. Oh, okay. We'll keep going. If you can take a drug take-back sign, please come see me after the meeting. I also have several books that need to go to the library. If there are 2 or 3 people here that could take some books with them, please come see me after the meeting. We'll get those books delivered to the library. Does anybody else have anything that needs to be mentioned? Okay, well, with that, we will end as always with a 4-way test of the things we think, say, and do. Number 1.
Is it true?
Number 2.
Is it fair to all concerned?
Number 3.
Will it build goodwill and better friendships?
And number 4.